Alpha from the Diabetes and Hypertension Help Society, DHS. Take a moment, read downwards, you will know what DHS stands for. I've been talking to you about abdominal pain, and I'm going to continue with the abdominal pain, and we're going to explore some other common causes of abdominal pain. You know, people, that many different conditions can cause abdominal pain, and the key is to know when you must seek medical care right away. In many cases, you can simply wait, use home care remedies, and call on your doctor at a later time only if the symptoms persist. Possible causes of abdominal pain would include appendicitis, which is an inflammation of the appendix. It could be bowel blockage or obstruction. You could have cholecystitis, which is an inflammation of the gallbladder with or without gallstones. You could have chronic constipation. There could be dissecting abdominal aortic aneurysm. You could have diverticulitis. You could have food allergy causing your abdominal pain. You could have food poisoning like the salmonella or the shigella, or viral gastroenteritis. Okay, stomach flu for short. You could have heartburn, you could have indigestion or gastroesophageal reflux. There could also be inflammatory bowel disease, which is called Crohn's disease, or ulcerative colitis. There could be intus who? Okay, it's up there, so you read it, intus whoever. While this is uncommon, it is a serious possible cause of pain in an infant who may be bringing its knees to its chest and crying uncontrollably. Now, you could have irritable bowel syndrome. There could be ischemic bowel. There could be kidney stones or lactose intolerance or mesenteric insufficiency or infection, which is lack of enough blood supply to the gut, sometimes resulting in the failure or death of part of the bowel or intestine. Sounds nasty. You could have pancreatitis, which is an inflammation of the pancreas, or tumors or cancers or ulcers or urinary tract infections when an inflamed organ such as the appendix in the abdomen ruptures or leaks fluid. The pain is not only excruciating, but the abdomen becomes stiff and very tender to the touch. There will also be a fever accompanying. Now, this occurs as in the case of peritonitis, which is an inflammation and infection of the lining of the abdominal cavity, and develops and spreads from the site of the rupture and goes on to the rest of the stomach. This is a medical emergency. You must seek help. In infants, prolonged unexplained crying, which is often called colic, may be caused by abdominal pain that may end with the passage of gas or stool. Colic is often worse in the evening, and then cuddling and rocking the child may bring some relief to the infant. Now, abdominal pain that occurs during menstruation may be from menstrual cramps, or it may indicate a problem in the reproductive organ. And this includes conditions such as endometriosis. Yeah, endometriosis, when tissue from the uterus is displaced to somewhere else, like the pelvic wall or the ovaries, or pelvic inflammatory disease. This is the PID, which is an infection of the reproductive organs, usually from a sexually transmitted disease. An ectopic pregnancy, or a pregnancy outside the normal location in the uterus, may mimic menstrual cramping and bleeding. However, symptoms are usually more intense than those usually experienced during a menstrual period. Abdominal pain may actually be caused by an organ in the chest, like the lungs, for example, pneumonia, or the heart, like a heart attack, or it may stem from the muscle strain in the abdominal muscles, like when you do a lot of crunches or sit-ups. Now, cancers of the colon and other gastrointestinal areas are serious but uncommon causes of abdominal pain. Other more unusual causes of abdominal pain include a type of emotional upset called somatization disorder, reflected as physical discomfort, including recurrent abdominal pain. Strep throat in children can cause abdominal pain as well. Abdominal pain, I'm almost having some from talking about it so much, but not so much so that I will not talk about the meal of the day. And the meal of the day says, good morning. I do enjoy your educative program on TV. My mother suffers diabetes, ulcer, and high blood pressure. She went through surgery yesterday because of the severe nature of the ulcer. What is the solution to her problem? Plus, her lips dries and she loses weight. This comes comes from Christy from DHS. Well, Christy, first of all, kudos for giving your mother medical care, and at this point, that's the best thing you can do. Just keep her in close contact with the doctors, with very good doctors. Give her the best medical care that you can afford. And we were able to tell Christy a few other things that she needed to help her mother. We can do the same thing for you. Our information and contacts are all up there on your screen. Don't forget to tell us who you are and where you're writing it from. And until I see you again next time, no abdominal pains. Goodbye.